The next page we have is the Interpretations and Diagnostics page. So the first line on here will automatically populate into the results, and all your lab results and radiology results will just automatically populate into here and into your chart. This is a good way to review all your results, and for radiology results, Dr. Brokish touched on this earlier, but this will only show the impressions. It won't show the body of the results. So if you wanted to see the body of the results, you'd have to see that from the tracker view. So to get rid of this half page, just click OK to get back to your menu right under it, and you can go into the rest of the documentation for your lab and radiology results. So one thing to document here is lab results interpretations. Labs reviewed. You could say that you reviewed all your lab results and all the findings. You can go into detail and interpret things yourself over here. Other things that you can use are the EKG interpretation. Documented in Muse, you can leave this one blank. This is for a separate program that EKGs are uploaded into that our providers do not document in. You can start with time and interpreted by and rate and all your findings right under. Compare it with previous EKGs. Now for a second EKG, refrain from just clicking on repeat EKG and saying unchanged. That won't be enough components to bill for that second EKG or reflect your findings of the EKG. So the best way to do it is to click the repeat, and now you have a second EKG over here, and you can just say compared with previous to compare it with your first one or with previous EKGs from other visits. Same thing for rhythm strips and pulse oximetry. For the pulse oxes, you can get those from your vital signs that popped up in physical exam. You can also look at those from review and looking at the nurse's notes and in the vital signs area up here. And then you could go back and document them, just return to go back to the page that we were on and to the document and document the pulse ox in there. Repeat for repeat pulse oxes. Radiology findings. So if the radiologist interpreted everything and you just want to review the chest x-ray, then you can just go interpreted by radiologist and reviewed by ED physician, and that will just reflect that you reviewed the chest x-ray and the radiologist was the one that interpreted it with the final read. If you interpreted an x-ray yourself, then you can go into detail and say interpreted by ED physician, reviewed by ED physician, and put in your findings. Otherwise, if the radiologist does it, then all you need to do is interpreted by a radiologist, reviewed by ED physician, and those results will automatically be imported from this results tab over here. This is going to be the same for CTs. All the CTs will show up here, and then CT general for all the general CTs. You can say interpreted by a radiologist. If you discuss with a radiologist for any of these, you can always say yes and put comments in for that discussion. Same thing for ultrasound and any other radiology findings there. And then CT general and X-ray interpretations are just general for all other X-rays or CTs that may have been done.
So I just had a couple things that Nasser touched on both of those very, very well. So we'll kind of go over the back, and this is again associated with kind of our data scores in billing for our charts. Again, the results, that's fine. That's going to populate automatically. The labs, I agree with Nasser 100%. You need to state that if you order the test that you reviewed them also. I would probably refrain from having to say this was normal, that was normal. That's not necessary, especially in this section, as this is going to probably be covered more in your kind of medical decision making at the end of the chart. These other ones, are all fine if you want to put anything in, but not necessary. So I would say just stick to the labs reviewed. Moving down to the EKG, again, the key points of this are one, the time is very important, interpreted by MD or ED physician is very important. And then the other thing that you really need to do is you can't just say normal. You need to actually put in probably at least 3 elements to be able to truly bill for your EKG. So normally that's going to be rate, you can do the rhythm, ST segments, whatever you want, but you need at least 3 elements in order to bill for that. So just saying normal is not okay and not sufficient. And same thing when you do a repeat, like Nasser said, if you were going to do a second EKG on your chest pain patient, you go to, repeat, you put in your documentation again. You can say it's unchanged, but technically, again, to bill for your second EKG that you did, again, you need to have 3 elements specifically documented in order to bill for that. Again, we pretty much interpret all our own EKGs, so that's definitely something we should get credit for. Talking about the x-rays again, and this was touched on very well, if you are going to the radiologist, you're going to use their review. Again, radiologist, but again, you want to make sure that, again, consistently you are looking at the films yourself that you say reviewed by, and you can put the ED physician. Again, if you are going to try to bill for this, say it's the middle of the night, your radiologists don't read at the middle of the night, it's 4 o'clock in the morning and there's a chest x-ray, again, you want to put, interpreted by ED physician instead of the radiologist, reviewed by the ED physician, and then you want to give your interpretation. Now, going to general and saying no acute disease and being done is not sufficient information to bill for that x-ray. It needs to have, again, probably at least 3 to 4 elements of that x-ray. You can say no infiltrate, no pneumothorax. You can then go down and say, no cardiomegaly, no vascular congestion, whatever you want. But I'd expect to see 3 or 4 things documented, because the hard part with the x-ray specifically will be, depending on what time it is, eventually that radiology report is going to be probably imported in there. So there's going to be a radiology report from the radiologist. And then the question is going to be, well, you're trying to say you're billing for this, but yet there's a report from another physician. So that's why it's imperative that you have your own documentation about why you did it and what your findings were, and obviously that you are going off those specific findings. And then, like Nash said, you have all your other CTs. Again, in any of these CT scans, ultrasounds, again, we're probably not going to bill for any of those unless it's an ultrasound or bedside ultrasound that you did, and then you can write that in under exam. You can say reviewed by, ultrasound exam performed by, and in this case you would say that that's something performed by you. And in one of these sections, probably the performed by, you would want to use those keywords: Quest Care ultrasound, Quest Care US, QC US, and that is going to be the note that is something that we are billing for ourselves. Your fast exam that you do, and there's a specific area actually for the fast exam. But if you're doing a limited of the abdomen for checking for a baby, those kind of things, these are all areas where you can put that information in yourself.